Good evening, everyone. It is great to have you all here again. I hope you guys had a wonderful weekend. I am excited being beginning another week. So we have our quote. Everything you want is on the other side of fear. I know some of you may have looked ahead at this week's material and thought, pharmacology seems like a lot. And honestly, that's a very normal reaction. Okay. I want you to take a moment and think about everything we've already learned together. In theory one, we explored every action in the operating room impacts patient safety. In micro, we learned how microorganisms affect patient care and why aseptic technique is so important. Now we're just adding another important piece to that puzzle, medications. I want you to remember something from the very beginning. I do not expect you to memorize 100 of drug names. Our goal is much simpler. We're learning how to think about medication safely as future STs. Now, throughout the course, again, we're going to focus on recognizing those patterns, kind of like we started in Mod 2, understanding why medications are used this time as opposed to micro and theory. Now, knowledge grows one connection at a time. I've noticed that many of you are visual learners. So throughout the course, I'm going to try to help you connect the ideas rather than memorize isolated facts. Once those connections begin to form, pharmacology becomes a lot more easier to understand. Okay? So let's get into where do we fit in? We know, or maybe hopefully you guys know, that as STs, we're not over there like, you get some Percocet, you get some ketamine. Okay? We're not doing that. But we are individuals who are independently there with the team. I want you to picture medication safety again as a chain. Okay? So you have the chain together. Every link in that chain has a responsibility. Your provider, whether it's the anesthesiologist or the surgeon, they're going to determine what medication is needed. The pharmacy, they're down there at the lab preparing, verifying the medication. The circulator and anesthesia provider are going through the safety procedures, and we have an important role within that process. If one chain breaks, the entire system becomes less safe. Now, we have to recognize what should happen. If noticing when something doesn't seem right, it's understanding why medications are handled carefully, labeled correctly, communicated, why we trust but verify. It's so that our role, we know, is to support a safe medication process. So let's see. If you're not the person prescribing or independently administering the medication, where do you think our role as a CST fits into the safety chain? Definitely verification. I like that. Definitely. If you don't remember anything else, we're trusting, we're verifying. Um, okay, hold on. Verifying, drawing up the meds, IC, communicating and verbally confirming medications. Most definitely. These are the observations that we're looking for. I want you to notice something. Almost every answer, believe it or not, relates to patient safety, not simply medications. That's exactly why this particular course is a part of you being in the ST program. Okay, so let's look at the architecture. Have you ever wondered why healthcare has so many safety checks? Maybe some of you have, maybe some of you haven't. But we always have to ask ourselves, why does everyone have to verify everything? The answer is actually very simple. Healthcare, again, doesn't rely on just one person to catch every mistake. It relies on the system. So I want you to picture several safety nets. If one safety check misses something, the next one has another opportunity to catch it. Each layer helps protect the patient. Now, you may see this. This is what's called system thinking, okay? Instead of depending on one perfect person, which does not exist, we depend on multiple people doing their part. Looking at all of these safety layers, why do you think medication safety isn't left to just one person or one step? That's a good one. Protect the patient. Anyone else? Yes, mistakes. We don't want mistakes to happen. So we build systems that help protect the patients. And today you've already seen where we as CSTs fit in that particular system. So let's zoom out just for a moment. Medication safety doesn't happen because one person is careful either. It also depends on organizations that create standards and regulations. It is going to be very important that you understand or be able to differentiate between the FDA, DEA, joint commissions, and you're going to hear it a lot throughout the course. What I want you to remember is that each one plays a different role in protecting our patients and helping protect the patient. It's going to be important for you to be able to identify how they fit in. Okay. Now, think about this. In a fast paced operating room, most individuals, they do not lack knowledge. Okay. Healthcare has to rely on one safety check um, to understand why another safety check is in place. Again, we're going back to those layers, which means that it relies on people, communication, and systems working together. So let's start looking at how medications move through. I talked about that chain, okay? Now, on paper, it's a very strong system. You're like, bam, the law, FDA is here, et cetera, et cetera, et cetera. But if the system is so strong, why do medication errors still happen? Is it because healthcare professionals don't care? No, right? Is it because they're unintelligent? Mm-mm. Most of the time, the fragile part of the system isn't the regulations itself. It's the human interactions within the system. See that crack? This broken link represents the moment where assumptions, distractions, interruptions, or miscommunications enter the process. In better words, to err is human, right? That's exactly where we as CSTs can make a difference. So let's take a look at what actually makes this link so fragile. Now, we get into our pillars. How do I say this? If you would like, please take a screenshot of this particular slide, okay? The reason I say that is because I want you to really be able to feel comfortable with this particular information. Long before a medication ever reaches the operating room, it's tested. Researchers ask questions like, is it safe? Does it work? Do the benefits outweigh the risk? Once a medication is approved, the work is not finished. It's regulated, and that's where concepts like drug scheduling and controlled substances come in the picture. More importantly, look at how many phases of a drug development as opposed to controlled substances. Okay. I want you to remember the purpose. The system exists to help reduce risk and protect the patient. Also, understand where different things happen in each phase is going to be really important. And then looking over here at the controlled substance, look at Schedule 1 versus Schedule 3 through 5. One has 4 phases, one has 5 schedules. Okay? Now, let's look at something that surprises many individuals. Do you think a medication name is just a label? No, right? See Maddie shaking her head. No. Medications carry information. It helps healthcare professionals identify exactly what medication they're working with. So let's build this connection. Two medications can look alike. They can sound alike. They can even have similar spellings. Those two differences matter a lot. When something doesn't look right, slow down, look again. Ask questions if needed. Pretty much everything we've been practicing the last module and we're carrying into this module. The reason I say that is because one of the safest habits in pharmacology is not memorization, it's careful observation. Also, notice your brand names are going to be capitalized as opposed to your generic names, lowercase. Look alike, sound alike. Systems like Talman, look at the lettering, you have fentanyl. They're used to prevent mix-ups. Really important. Now, here's a concept that I want to kind of get you to really dive in and understand. When people hear the phrase right dose, they usually think that's just the number, but it's much bigger than that. Okay. For a medication to be given safely, it has to be the right medication, the right strength, the right route. Those three pieces work together. You've got two patients on the schedule. They're both scheduled for a laparoscopic appendectomy. Okay, so they're going to go in, remove the appendix through cameras. You've got one patient that is a neonate, 1 hour old. This scenario is most likely unlikely, but just go with me, okay? You got a, neonate, right? As opposed to a 35-year-old, 150 linebacker. Same case, same surgeon. Do you think the medications are going to be the same amount, right? So, if you have the correct medication, what if it was given in the wrong route? Okay, hypothetically. It's still the right dose, but it's the wrong route. It's all about making sure that every piece fits together. That is, how do I say, an important patient safety skill. Okay. Now, we're going to hone this in multiple times in this course, but it's being introduced now. We got to put our medication safety mindset into actual practice. I want you looking for risks. Okay. You've got heparin, 100 units in ml versus 10,000 units in ml. You've got epinephrine, topical versus injection. So I want you just to observe what you see, looking at the risks, especially when it comes to epinephrine. Topical is used for one, injection for something different. Same medications in both. All right, so let's start with the first example. Medication name is the same. Heparin, sodium, injectable. What changed? Exactly. Strength of concentration. Was it right? Now, the medication itself is not wrong, but using the wrong strength could still result in patient harm. So, case two. Again, medication is correct. Like we're using epinephrine. Most definitely we're using epinephrine. But this time, what changed? Exactly. The route is different. Notice something about these examples. No one necessarily chose the wrong medication on purpose, right? The problem happened because of those small details. And that's why you're going to hear a lot of attention to detail, because you're focusing on that one correct detail and you assume everything else matched. Again, we look at that to err as human. Assumptions, as we know, create risks. Verification creates safety. That's why we say trust but verify. All right. Now, our responsibility, we know, is not going in and grabbing morphine and cocaine. We do have in some spaces propofol, right? We're not grabbing that and mixing it and be like, ha, this is what we're going to use for our patients. But we still are responsible when something doesn't match the expected purpose. Communicating appropriately is going to be important, especially when it comes to our entire team. Something doesn't look right. We notice there is a shellfish allergy, and now we've got a medication that could potentially cause this patient to have a um, effect that we don't want, right? So we're recognizing that something doesn't look right is going to be one of the ways that, again, we protect our patients. So we get to that final medical safety check. Okay, we're going to bring it all together. We talked about safety, medications, communication is huge. To err is human. We know that's a human factor. And we briefly looked at how errors can happen. Now let's connect it to what we do. All of the organizations, all of the regulations, even those safety checks eventually reach one place, the operating room. That's where we become part of the medication safety system. We do not work in isolation. We are extremely important to the team, but our actions are going to matter. We're labeling medications accurately. We are verifying. We are communicating clearly with the team. I want you to notice something. Nothing so far is super complicated, but every one of these steps are important. They're not extra, they're patient safety steps. I'd like you to begin thinking of yourself this way. Every label that you read, every medication that you verify, every question you ask for clarification is just another opportunity to help protect your patient. So, which of these responsibilities do you think requires the greatest attention to detail? There is no wrong answers. I'm just curious as to what you think. Okay? Got labeling, calculating administrative drugs. Then I ask you, why this particular question? Like, why would I ask this question? Remember, it doesn't require clinical experience. It reinforces how you guys are looking at things, your observations. It gets you to start thinking about accountability without putting yourselves outside of your scope of practice, right? Like you can sit back and look and be like, okay. Now, what we're about to do next, you're definitely going to see in one of your exercises. So really lock in, okay? If I could choose one medication safety process for you to remember from today's class, it would be this one. You can take a screenshot. Why? Because this isn't simply a conversation between two healthcare professionals. It goes back to week 2 in mod 2 with communication and closing the loop. It's a standardized safety protocol, and every step has a purpose. I want you to notice something. Earlier, we talked about communication, assumptions, closed loop, medication safety systems. This is where we're bringing everything together. So let's look at these steps together. Okay, again, you're going to see this. And you're going to be doing this literally every day you're in the operating room. Circulator is going to read the medication label. Why? Everyone starts with the same source of information. Step 2. The circulator reads the label aloud. Now the information isn't just seen, it's heard. Step 3. I have my eye drops, so this is going to be important for you guys to follow along. The circulator shows the label. So Maddie's in front of me. So I'm showing Maddie my medication. Okay. I don't know if it's show. There we go. There we go. I'm showing her my medication. Okay. Maddie's my scrub person. Now she can verify independently. So she's trusting me, but she needs eyes on. So if I was to say, so I'm going to read it and be like, refresh liquid gel. Okay. And then I'm going to show her, if I can get it in the camera, refresh liquid gel. So she's actually seeing it as well. Okay. Step 4. Now she repeats exactly what she sees. Granted, I know what I said, but she's now repeating with her own verification what she sees. Notice something. She's saying it aloud, okay? We're not just simply saying, okay, cool, gotcha, right? She's actively looking and confirming, like she's okay, I trust you, professor, but I need to see for myself, okay? That's what's happening. Are you with me so far? We're at step 4. Okay. Now, step 5. Now she will accept the medication from me. A lot of times we'll have a medication jar, let me grab a top of something, right, where she will allow me now to kind of pour it into her, pour it or draw it up. You guys are going to learn all the ways in lab, okay? Now, and 300, we talk about it. Now, only after verification does she accept the medication. Let me repeat that. Only after verification will the scrub person accept the medication. We get down to step 6. This is extremely important. The medication is labeled immediately, and I want you to see what I kind of highlighted in a different color. Immediately. It's not optional. It's a patient safety expectation. So let me ask you something. Why do you think this entire process is spoken aloud instead of everyone simply doing one of those numbers, like reading the label silently to themselves? I love those answers. Think about everything we talked about tonight. It is everyone's responsibility, right? No one knows whether the information was understood. But when it's spoken, when it's repeated, when it's confirmed, the entire team is participating in the safety process. As future STs, I don't want you to only memorize the 6 steps or the steps in general because you're going to be doing this every day. Like it's going to be ingrained in you. I want you to understand the purpose besides knowing how it's done. The goal isn't, okay, I got this done, checklist, right? The goal is making it difficult for an error to reach the patient. Think about that. We're trying to make it difficult for an error to meet, to reach our patients. Here's another thing that you're going to be doing daily, and you will see it in expressed in your exercise this week. So I really want to break this down because yes, it's a part of academia and understanding it, but because you never know, me and Natalie may be in a facility together and she has to relieve me. And I've got a bunch of syringes. I'm OCD, so everything is labeled and everything, and she feels awesome. But she may go into someone else's room where they have a bunch of clear liquids, and this tech's like, oh, I was going to label it. Now he's going to be like, that's cool. I need new ones, right? But let's say she does go in my room and she sees everything labeled nice and neat. She can kind of see exactly where it goes. So for this one, this is really important. If it's not labeled, it is not safe. No exceptions. We talked about assumptions, right? This slide is where assumptions become dangerous. A lot of the liquids that you're going to have on your field are clear, from heparin, epinephrine, just a lot of different drugs that we're going to get in deeper throughout this course. I want you to imagine this. You're halfway through a surgical procedure. There are multiple syringes on your sterile field. Everyone is focused on the patient. You look down at one syringe, it's not labeled. Can anyone safely tell me what's inside it? Right. Maybe someone in the room thinks they knew. Maybe someone prepared it. Maybe someone's like, oh, I remember. But patient safety never depends on I think. It depends on I know because I trusted and verified for myself. So, what information belongs on every medication label? You have your name. In this particular instance, you'll have bupivacaine, marcaine, lidocaine. We're going to get deeper into it, so don't worry about the name specifically. But if you see, we're talking about the drug name. We want to know the concentration strength, because remember, that's important. Are we dealing with 0.5%, 10%, 25%? And the volume, 50 cc's, 50 ml, etc. And date and time. I don't want you memorizing the list. I want this ingrained in you so that, yes, when you see it on a concept this week, you'll be able to answer it. But more importantly, it becomes second nature when you're in that lab, when you're at the clinicals, and you're getting ready to protect the patient. I went too fast because I want you guys, if you want to take a screenshot, you can. Okay. Now, the biggest thing is that you label medications because patients deserve certainty. That's just professional. Okay, that's your professionalism kind of coming through. And as the patient's advocate, you're protecting them so that no error can get to them. Okay, are you good for me to move on? Guys, thumbs up if you guys are good. Okay, I see some shakes. All right. By now, you may be wondering, why are healthcare professionals so specific about every little step? Or maybe you're not because you know that you're part of elite and that's just what we do. But for those who may be thinking about it, the answer is simple. Small actions can have very large consequences. Think about everything we've discussed: label, concentration, route, verification. Each one seems small by itself, but together they create a safe medication process. Okay, let's see. What do I want to ask? All right, here we go. How does understanding the why behind these safety steps change the way you think about them? From using room temperature irrigation to verifying drug compatibility, even confirming weight-based dosing for our PEDS patients. I love this one. Understand the effects it has. What else? Who are we ultimately trying to protect? Perfect. All of these. They can affect the patient if not properly used. If medication is not the correct dose, temp, it interacts with any other drugs, it can put the patient at risk. Perfect answers, y'all. Professional attention to detail isn't about perfection, it's about consistency. The safest healthcare professionals aren't the ones who never make mistakes. And if you run into one of those, be cautious. Just being transparent with you guys. They're the ones who consistently follow the safety process. Something happens, we fix it, we report it, we do what we're supposed to do because at the end of the day, we're trying to protect our patient. Okay, I want you to look at the image for just a second. Notice where all the lines end. They all lead to medication. Every one of the lines represents something we've talked about tonight, whether it's regulations and making sure you understand those entities, communication, verification, labeling, teamwork. They're all working towards one goal. Again, we just mentioned it, we're trying to protect our patients. And now look at the center of that image. That's where the medication reaches the point of care. That's where we, as CSTs, become part of the safety system. Looking at the image, what message do you think it's trying to communicate about our role as the CST? What's in the highlighted box, more specifically? I love it. Let me read some of these. If medication is not the correct dose tip, okay, we got that one. Our role is to verify and pay careful attention to detail to ensure our patient is always safe. Yes, attention to detail, patient safety. Learning these protocols protect our patients further, most definitely. There are a lot of processes and rules that we have to go through, but all of it is to ensure safe medication administration. Most definitely. Now, I hope tonight changed the way you think about pharmacology just a little bit because you'll notice that when we go through it, it's going to be less about this medication is this, more about how this medication is introduced to the patient and how we keep the patient safe. That's how we look at pharmacology through the lens of surgical techs, okay? We're trying to recognize our role in medication safety. Every label, every verification, every question, every communication that we encounter, especially down to the details, again, comes to one thing: protecting our patient. You'll notice that this is a shorter week, okay? With that, I'd like you to think about one final question. Which one habit from today's lesson do you think will matter the most when you're actually working in the operating room? Attention to detail, paying attention to detail, speaking out loud is going to be really big too. Clear communication, definitely like that one. Let's see, paying attention, and listening. I love that because remember with communication, being able to listen is going to be just as important. Now, one of the things I hope that you're taking away from tonight um, is that medication safety is not one of those things that's built on just this huge decision, right? It's built on many small ones, consistent decisions, deciding that Maddie's not going to just trust that I'm like, oh yeah, this some refresh liquid gel, you can put it on your field, right? No, she's going to verify. We are in week two, but you've already beginning to think even more in detail. You've taken what we've done in Mod 2 and you're kind of building onto it. That's how this program works, okay? Instead of simply asking, what is this medication? You're going to notice you're asking yourselves, how do I make sure that this process protects this patient during this procedure at this time? That's going to be the mindset that you're walking into, that we are building throughout this particular course. Now, for those of you that are watching the archive, you are just as important to this week's conversation. So you'll notice that the questions are slightly different from what you may have been used to in the past because I really want to see how you're thinking through this process. So, how can a CST help prevent a medication error when, let's say, similar medications or concentrations are present on the sterile field? If something about a medication doesn't match your personal experience, how would you respond professionally while supporting patient safety? And why is the CST considered a critical safeguard in medication safety, even though we as CSTs do not independently administer medication? Now, I'm looking for your reasoning and your application of the concepts from this week, not a simple textbook definition. I want to know what you feel and how you interpret this particular information. as you guys continue through this program, as you guys have already been doing, y'all, please do not stop asking questions. Remember to kind of slow down when you get to some of the questions. Um, Continue building the habits that protect patients. Starting next week, we will start going over some of the highly missed questions. Okay, so we'll grab some from this week, and then we'll start kind of going over like we did module 2. With that, what questions do you have for me? Before I get into that, keep in mind that 7:15 office hours are still being held, okay? But you guys have a nice little break. But okay, what questions do you have for me? All right, if something does come up, okay, so how does reconstruction take place in the operating? Great question. So I am not going to get too far in advance because we actually break that down around week 7 or 8. So just know that I'm gonna actually show you videos. Not only here, we do it here and in mod 3. Mod 3, we are mod 3. In 3 too. So keep that question on the back burner because you're gonna actually see it. I have a video that shows you exactly how we do that. So I love that you're already thinking ahead. Is the reconstruction done by anesthesia tech or circulator? Depends on the medication, depends on the purpose. Again, so so we don't get confused for week 2, but no, we will break that down and you will see it, and I will be able to explain when certain situations anesthesia goes over it and certain situations where you and your circulator are working together. But I love how you're thinking. You are welcome. uh Again, you're going to see that I love this. So do we hold the vial while the surgeon or circulator draws it? This is going to be another one that you will definitely visually, visually, physically see, and you will practice it in the lab. So you'll see multiple ways of it being done aseptically, like making sure that everything stays sterile, because that's the biggest thing, making sure that it stays sterile. Excellent questions. Anything from this week? Because you guys are going to be like, aha, you're going to see the light bulb go off when we get to those weeks and you see it and you're like, aha, okay, all right. All right. Well, with that, y'all have a wonderful rest of your evening, and I look forward to everyone who can attend theory tomorrow evening. Good night, everyone, and thank you for your participation. It really means a lot. Like, I love this. Keep them up. Good night, everybody.